So welcome everyone to my channel, which is Pharmacokinetics. So in today's Pharmacokinetics class, I'll be telling you about the drug profile of different drugs. So before to start, let me tell you about the drug profile. Like, what is drug profile? So it is the profile of a drug, or we can say profile containing the complete information about the drug, including pharmacokinetic, pharmacodynamic, drug-drug interaction, drug-food interaction, mode of action, dose, dosage, and many other things. Achha, so today we have drug epinephrine. It is also called adrenaline. It is an adrenergic drug. So the word adrenaline means next to the kidney, because ad means next and renaline means kidney. So epinephrine is also known as suprarenin. Adrenaline is a drug as well as hormone. Adrenaline is produced by adrenal gland. So एपिनेफ्रिन को एड्रेनालिन भी कहा जाता है और ये एड्रेनर्जिक ड्रग है. The word adrenaline means next to the kidney because the word ad means next and renaline means kidney. एपिनेफ्रिन को सुप्रारेनिन भी कहा जाता है और एड्रेनालिन एक हार्मोन भी है और ये प्रोड्यूस होती है बाय द एड्रिनल ग्लैंड. और एड्रिनल ग्लैंड के टू पार्ट्स होते हैं. द आउटर वन इज कॉर्टेक्स जो कि स्टीरॉयड प्रोड्यूस करता है एंड द इनर वन इज मेडुला जो कि कैटेकोलामीन प्रोड्यूस करता है. नाउ द प्रोडक्शन ऑफ एपिनेफ्रिन. सो phenylalanine that is produced naturally within body or the food that we intake. So phenylalanine is responsible for production of tyrosine through the hydroxylation, and from tyrosine dopa is produced, and from dopa norepinephrine is produced, and from norepinephrine or epinephrine is produced. See, phenylalanine is responsible for production of tyrosine through the hydroxylation. From tyrosine dopa is produced, and from dopa it will produce norepinephrine. Norepinephrine is the precursor of epinephrine, and through methylation by COMT and oxidation by monoamine oxidase it will produce epinephrine. और एपिनेफ्रिन नॉन सेलेक्टिव ड्रग है. क्यों? क्योंकि ये अल्फा 1, अल्फा 2, बीटा 1, बीटा 2, गामा 1 एंड गामा 2 रिसेप्टर पे एक्ट करती है. So epinephrine is a non-selective drug. It acts on all type of receptors like alpha 1, alpha 2, beta 1, beta 2, gamma 1 or gamma 2. But it has different functions on different receptors. Epinephrine is used in emergency condition like cardiac arrest, etc. because it is non-selective and will act on any receptor which body needs the most. Here, beta 1 acts as a vasoconstrictor, therefore it causes vasoconstriction, and beta 2 acts as a vasodilator and it will produce vasodilation. Unbound or free form of drug produce pharmacological effect. When epinephrine acts on beta 1 receptor of heart, it will increase force of contraction and BP. And this drug is produced for positive ionotropic effect and positive chronotropic effect. And positive ionotropic effect is produced by those agents which increase the force of contraction. And positive chronotropic effect is produced by those agents which increase the heart rate. So there are 4 functions of adrenaline. Number 1 is cardiac arrest, asthma, bronchial anaphylaxis, insulin, hypoglycemia. Now the mode of action. In case of cardiac arrest, beta 1 effect is more prominent as compared to beta 2 and produce vasoconstriction. And in case of asthma, beta 2 effect is more prominent as compared to beta 1 and produce vasodilation. And it also inhibits insulin secretion by acting on alpha 2 receptor. Now the side effect of epinephrine. Number 1 is anxious feeling, dizziness, fast heartbeat, generalized weakness and headache, loss of skin color, muscle tremor, nervousness and high BP. Now the drug-drug interaction. So the interaction of epinephrine with digoxin, as digoxin is cardiac glycoside and also used in cardiac problem. If it gives with adrenaline, so it causes synergism, means increase the effect, which is very fatal and leads to death. Now the interaction of epinephrine with quinine, as quinine is anti-malarial drug. If it gives with adrenaline, so it alters the effect of adrenaline, means effect may be increase or decrease. Now the interaction of epinephrine with local anesthetic. If local anesthetic such as lignocaine, benzocaine gives with adrenaline, so it causes prolonged effect of epinephrine by decreasing its release. Now the dose and dosage. It is mostly available in the form of diluent as 1 by 10, 1 by 100 and 1 by 1000, and the other formulations are also available. It is also available in the form of salt as epinephrine HCl because it is soluble in water. And these diluents are used for different purposes in different concentration like ophthalmic diluent, inhalation diluent, topical diluent, parenteral diluent, and etc. Now the standard dose in case of cardiac problem, which is 100 to 250 microgram. If condition of patient is severe, it may be increased up to 1 milligram. Standard dose in case of bronchial anaphylaxis in adult 0.5 ml, which is equal to 500 microgram, and in children up to 12 years, which is equal to 0.25 ml, and it is 250 microgram. And in children up to 16 years, it is 0.25 ml, which is equal to 250 microgram, and in children of 6 months to 6 years of age, it is 0.12 ml, which is equal to 120 microgram. In children below 6 months of age, 0.25 ml, which is 50 microgram. अच्छा जी, अब anti-TB drugs की बात करते हैं. And these anti-TB drugs are used for the treatment of tuberculosis. And this TB is a chronic disease of lung. In early history, it was very dangerous and caused death. It belongs to Mycobacterium class, which transfer through inhalation. And it has two classes, the first line therapy and the second line therapy. So there are some drugs that we use in first line therapy, and if the person fails against the first line therapy, then we give the second line therapy. And the drugs including isoniazid, rifampicin, ethambutol, and pyrazinamide, and the other drugs like antibiotic involving levofloxacin, ciprofloxacin with isoniazid and rifampicin. In 1955, WHO started a program known as DOTS, which is Directly Observation Treatment Course. In this program, they give the information regarding TB, in which they firstly said that this disease is transmitted from person to person. So now the isoniazid, which is also known as INH, is the first line therapy drug. It's most potent and mostly given in combination with rifampicin or rifampin. It's discovered in 1912 as a chemical, but in 1951 further research held on which elaborated its activity and said that it's the most potent antibiotic TB drug. अच्छा जी, सो आइसोनियाजिड को आईएनएच भी कहा जाता है. ये फर्स्ट लाइन थेरेपी की ड्रग है. ये मोस्ट पोटेंट और मोस्टली कॉम्बिनेशन में रिफाम्पिन दी जाती है. ये डिस्कवर हुई थी 1912 में एज अ केमिकल. उसके बाद इसकी एंटीबैक्टीरियल एक्टिविटी 1951 में डिस्कवर की गई, जो कि मोस्ट पोटेंट एंटीबायोटिक टीबी ड्रग है. And all the compounds which contain pyridoxin vitamin B6 related structure also have anti-TB activity. That's why we are supposed to take vitamin B6 along with anti-TB drugs. Mechanism of action. It inhibits the synthesis of mycolic acid, and mycolic acid is long fatty acid which is present in Mycolata Taxon. And mycolic acid play important role in synthesis of cell wall, means provide morphological shape. If mycolic acid less supply or diminish, so cell wall become weak and lysis occurs. मतलब माइकोलिक एसिड इम्पोर्टेंट रोल प्ले करता है सेल वॉल की सिंथेसिस में, और ये मॉर्फोलॉजिकल शेप प्रोवाइड करता है. इफ माइकोलिक एसिड सप्लाई डिमिनिश हो जाए तो सेल वॉल वीक और लाइसिस हो जाती है. नाउ द ethambutol, अगेन इट्स द फर्स्ट लाइन एंटी टीबी ड्रग. ethambutol भी फर्स्ट लाइन एंटी टीबी ड्रग में शामिल है. द मैकेनिज्म ऑफ एक्शन. So it inhibits the arabinocell enzyme. This enzyme is required for polymerization of arabinoglycan, which play important role in synthesis of cell wall. अगर ये एंजाइम इनहिबिट हो जाए तो पॉलीमराइजेशन ऑफ अमीनो ग्लाइकॉन नहीं होती। दैट्स व्हाई सेल वॉल बिकम लाइक, मतलब ये ड्रग इनहिबिट करती है अरबिनोसाइड ट्रांसफरेज एंजाइम को, और ये एंजाइम ज़रूरी होता है पॉलीमराइजेशन ऑफ अरबिनो ग्लाइकॉन के लिए, जो कि सिंथेसिस ऑफ सेल वॉल में वाइटल रोल प्ले करता है। और अगर ये एंजाइम इनहिबिट हो जाए तो पॉलीमराइजेशन ऑफ अरबिनो ग्लाइकॉन नहीं होती है। एज अ रिजल्ट सेल वॉल वीक और उसकी लाइसिस हो जाती है। नाउ द फार्माकोकाइनेटिक, it's well absorbed orally, 70 to 75% excreted in unchanged form and remaining 15 to 20% excreted in metabolite of aldehyde and carboxylic acid form. Due to excretion in unchanged form, it should be given cautiously to the renal patient, and the plasma half-life of this drug is 2 to 3 hours. It develops resistance slowly. सो ये ड्रग ओरली वेल एब्जॉर्ब होती है और ये 70 to 75% एक्सक्रीट होती है अनचेंज्ड फॉर्म में, और रिमेनिंग इसके जो 15 to 25% हैं वो मेटाबोलाइट फॉर्म में एक्सक्रीट होते हैं, जो कि एल्डिहाइड और कार्बोक्सिलिक एसिड की फॉर्म में होते हैं, और ये एक्सक्रीटेड होती है अनचेंज्ड फॉर्म में। देयरफॉर कॉशियसली देना चाहिए रीनल पेशेंट में, और इसकी प्लाज्मा हाफ लाइफ 2 to 3 hours है, और ये डेवलप करती है रेजिस्टेंस स्लोली। And now the side effects. The side effects are like nausea, vomiting, headache, GI disturbance, confusion, dizziness, optic neuritis, which is the major side effect. And the general properties are like capable of crossing CSF and BBB. मतलब इसके side effect nausea, vomiting, headache, GI disturbance और confusion, dizziness and optic neuritis होते हैं। और इसकी जनरल प्रॉपर्टीज़ में ये है कि ये क्रॉस करती है CSF और BBB को। So the contraindications. So cautiously give to the patient having renal problem and don't give children below 6 years of age due to its more penetration. मतलब ये renal patient में कॉन्शियसली देनी चाहिए, और ये चिल्ड्रन बिलो 6 year old उनको नहीं देनी चाहिए, क्योंकि इसकी पेनिट्रेशन बहुत ज़्यादा होती है। Now the dose, which is 15 mg per kg per day, should give alone because it has drug-drug interaction with other anti-TB drugs. When give 25 mg per kg per day, so it causes major side effect, which is optic neuritis. Now the drug-drug interaction. Other anti-TB drugs, when ethambutol gives with other anti-TB drugs, so it synergize the effect of other anti-TB drugs. मतलब इसका डोज कुछ यूँ है कि ये 15 mg per kg per day दी जाती है, जो कि अलोन दी जाती है, बिकॉज इट हैज़ ड्रग इंटरेक्शन, क्योंकि इसका ड्रग इंटरेक्शन होता है विद अदर एंटी-TB ड्रग्स। और ये जब 25 mg per kg per day दी जाती है, ये मेजर साइड इफ़ेक्ट कॉज करती है, जो कि ऑप्टिक न्यूरोराइटिस है। और अगर इसके ड्रग इंटरेक्शन की बात की जाए तो विद अदर एंटी-TB ड्रग व्हेन ethambutol गिव्स विद देम, तो ये सिनर्जाइज करती है उनके इफेक्ट को। नाउ द फार्माकोकाइनेटिक. So it's well absorbed orally and metabolized in liver through hydroxidation. During metabolism, pyrazinic acid is converted into hydroxypyrazinic acid, and it is excreted in kidney, and plasma half-life is 5 to 10 hours. And the dose is like 600 mg per day, also available in tablet in 500 mg per day. Side effects are like nausea, vomiting, hepatotoxicity, and hyperuricemia, which is the excess amount of uric acid in blood. Now the drug-drug interaction of pyrazinamide. So other antibiotic drugs, when pyrazinamide given with them, so it potentiates the effect of other drugs. In pregnancy, it's the only anti-TB drug which is given during pregnancy safely, but the condition is that given alone, means no other anti-TB drug should be given during pregnancy along with pyrazinamide. Means pyrazinamide drug जो है वो pregnancy में safe है, लेकिन तब जब हम उसे alone देंगे, not with other anti-TB drugs. Now the rifampin. It's also known as rifampicin. In 1955, WHO started DOTS, which is Direct Observation Treatment Program, in which give detailed information about anti-TB drugs. It's part of every combination of fixed dose therapy except pregnancy. It's more potent than all other drugs because it is directly act on RNA polymerase of microorganism, and the source is like it is obtained from the Streptomyces mediterraneae. It's highly colored compound due to its more absorbance on spectrophotometry. That's why its manufactured area is. It belongs to class macrolide. Mechanism of action is like it acts on RNA synthesis, means inhibits synthesis of RNA. It combined with RNA dependent polymerase enzyme and block the action of this enzyme. Actually, this enzyme is responsible for the synthesis of मतलब ये हाईली कलर्ड कंपाउंड है क्योंकि इसकी एब्जॉर्बेंस ऑन स्पेक्ट्रोफोटोमेट्री ज़्यादा होती है. दैट्स वाई इसका मैन्युफैक्चर्ड एरिया भी रेड होता है और ये क्लास मैक्रोलिड से बिलोंग करती है. मैकेनिज्म ऑफ एक्शन इसका कुछ यूं है कि ये आरएनए सिंथेसिस को स्टॉप कर देती है बाय एक्टिंग ऑन आरएनए डिपेंडेंट पॉलीमरेज एंजाइम. और इसकी जनरल प्रॉपर्टीज कुछ यूं हैं कि ये बैक्टीरियोसाइडल है. इट्स हाईली रेजिस्टेंट बाय चेंजिंग देयर आरएनए डिपेंडेंट पॉलीमरेज. नाउ द फार्माकोकाइनेटिक. इट्स वेल एब्जॉर्ब्ड ओरली and metabolized in liver, excreted 60 to 65% in feces and urine. Its feces colored become red or orange and urine also become red. Its plasma half-life is 1.5 to 5 hours and prolonged effect may up to 6 to 8 hours, and its peak concentration occurs after 1 to 2 hours after administration of drug. अब इसकी जनरल प्रॉपर्टीज कुछ यूं हैं कि ये बैक्टीरियोसाइडल है और ये हाईली रेजिस्टेंट है बाय चेंजिंग देयर आरएनए डिपेंडेंट पॉलीमरेज. और इसकी फार्माकोकाइनेटिक कुछ यूं है कि ये वेल एब्जॉर्ब होता है ओरली और मेटाबोलाइज होता है इन लिवर और एक्सक्रीट होता है 60 to 65% इन फीसिस और यूरिन. और प्लाज्मा हाफ लाइफ इसकी 1.5 to 5 आवर्स है और ये प्रोलॉन्ग इफेक्ट दिखाता है 6 to 8 आवर्स का. और इसकी पीक प्लाज्मा कंसंट्रेशन जो है 1 to 2 आवर्स के बाद हमें मिलती है. नाउ द साइड इफेक्ट्स. द साइड इफेक्ट्स आर लाइक नाजिया, वोमिटिंग, हेडेक, जॉन्डिस, हेपेटोटॉक्सिसिटी, ल्यूकोपेनिया, थ्रोम्बोसाइटोपेनिया, ड्राई इचिंग मीन्स इचिंग विदाउट रेश. नाउ द डोजेस. The adult doses 600 mg per and in children 15 to 25 mg per day. Take 1 hour before meal and 2 hours after meal because it interacts with food and delay its absorption. मतलब इसके साइड इफ़ेक्ट कुछ यूं हैं कि ये नाउजिया, वोमिटिंग, हेडेक, जॉन्डिस, हेपेटोटॉक्सिसिटी, ल्यूकोपेनिया, थ्रोम्बोसाइटोपेनिया और ड्राई इचिंग करवाती है. और इसका डोज कुछ यूं है कि ये एडल्ट में 600 mg पर डे दी जाती है और चिल्ड्रन में 15 to 25 mg पर डे दी जाती है. और ये 1 hour बिफोर मील और 2 hour आफ्टर मील दी जाती है. क्यों? क्योंकि ये इंटरेक्ट करती है विद फूड एंड डिले इट्स एब्जॉर्प्शन. हाउ द इंटरेक्शन. सो आइसोनियाजिड व्हेन गिवन विद रिफेम्पिसिन, as rifampicin is an enzyme inducer and isoniazid is enzyme inhibitor, so if they give together, so they counteract the effect of each other. Warfarin, anti-hypertensive, beta blocker, calcium channel blocker, anti-arithmetic, sulfa drug, narcotics. If rifampicin given with these drugs, so metabolism of these drugs will be increased because as I told you that rifampicin is enzyme in ड्रग इंटरेक्शन. रिफेम्पिसिन की कुछ यूं है कि अगर ये आइसोनियाजिड के साथ इंटरेक्ट करे तो इन दोनों का इफ़ेक्ट जो है वो ख़त्म हो जाता है. क्यों? क्योंकि रिफेम्पिसिन एंजाइम इंड्यूसर है और आइसोनियाजिड एंजाइम इनहिबिटर है. और अगर ये वारफरिन, एंटी हाइपरटेंसिव ड्रग, बीटा ब्लॉकर, कैल्शियम चैनल ब्लॉकर, एंटी अरिथमेटिक, सल्फा ड्रग्स, नारकोटिक्स इनके साथ दी जाए तो ये इनका मेटाबॉलिज्म इंक्रीज कर देती है. नाउ द इंटरेक्शन ऑफ कीटोकोनाजोल विथ रिफेम्पिसिन. कीटोकोनाजोल इज एंटी फंगल ड्रग. It effect on G.LT by change its pH from acidic to alkaline. That's why if rifampin is given with ketoconazole, so its absorption is decreases because it's well absorbed in acidic medium. Now the interaction of rifampin with aminosalicylic acid. It also delays the absorption of rifampin. That's why if they are taken together, so maintain the gap between 8 to 12 hours. तो रिफेम्पिसिन का इंटरेक्शन विद कीटोकोनाजोल कुछ यूँ है कि ये कीटोकोनाजोल ये एंटी फंगल ड्रग है जो कि G.LT की pH को कन्वर्ट करती है एसिडिक टू अल्कलाइन, और ये हमारी रिफेम्पिसिन ये अपना जो है असर वो दिखाती है एसिडिक मीडियम में। तो ये एंटी फंगल ड्रग एसिडिक मीडियम को अल्कलाइन मीडियम में कन्वर्ट कर देती है, देयरफॉर एक्शन ऑफ रिफेम्पिसिन विल बी डिस्टर्ब। और अमीनो सैलिसाइक्लिक एसिड भी इसका जो है इसके एब्जॉर्प्शन को डिक्रीज कर देती है, देयरफॉर जब हम इन दोनों को साथ में लें तो देयर शुड बी गैप ऑफ 8 to 12 आवर्स। और अब हम बात करते हैं साइटोक्रोम P450 के बारे में। सो इट इज़ द कंप्लीट सिस्टम ऑफ एंजाइम which is responsible for the release of enzyme. This complete system present in liver which is responsible for the metabolism of endogenous substances like steroids, lipids, etc. Cytochrome P450 is designed as CYP because it is designed as many family of heme in blood. There are family of enzyme which are present and these are called Iso Enzyme which are present in liver and G.LT. Why called P450? Because it derived from spectral peak at the wavelength of the absorption maximum of enzyme like it 450 nanometer. It means it shows the absorption maximum absorption is 450 nanometer. When isoenzyme is in reduced state, so it treated with carbon monoxide which is CMO. It works as a catalyst or speed up or increase the reaction. Why also called microsomal mixed function oxidases? Metabolism has two phases, phase 1 and phase 2. In phase 1, drug may be active, inactive or unchanged, or in this either oxidation, reduction or hydrolysis occur, whereas in phase 2, drug is inactive or in which conjugation occurs. In phase 1, during oxidation, the oxidase catalyzes the oxidation reaction, in which molecular oxygen is the electron acceptor, but oxygen atoms don't appear in the oxidized product. That's why called mixed function oxidase, because at the same time, enzyme oxidizes two different substrates simultaneously. For example, in metabolism of phase 1 reaction of aspirin, drug oxidation occurs. So there are three conditions of metabolism. Number 1, some drugs active in phase 1, so for inactivation in phase 2, they go for conjugation. Number 2, some drugs inactive in phase 1, so in phase 2, they easily metabolized. Number 3, some drugs bypass the phase 1 reaction. Hydrophilic drugs easily go to phase 2 reaction rather than lipophilic drugs. So अब हम atropine drug की बात करते हैं. So why we called it Atropa belladonna? Actually, belladonna is the name of lady. She used atropine to make her eyes beautiful. That's why it is named as Atropa belladonna. And it is an alkyl drug having nitrogen in its ring. अच्छा जी, Atropa belladonna को Atropa belladonna क्यों कहा जाता है? क्योंकि belladonna नेम था एक लेडी का जो कि atropine यूज़ करती थी अपने आइज़ में to make her eyes beautiful. इसीलिए इसका नाम Atropa belladonna रखा गया. और ये एक alkyl drug which is having nitrogen in its ring. And now the mechanism of action of atropine. So it's an anticholinergic or muscarinic antagonist, means block acetylcholine, a neurotransmitter by which act on M2 receptor causes dilation of pupil of eye. मतलब ये एक anticholinergic drug है और इसको muscarinic antagonist भी कहा जाता है और ये ब्लॉक करती है एसिटाइलकोलिन को जो कि एक न्यूरोट्रांसमीटर है बाय एक्टिंग ऑन M2 रिसेप्टर. एज अ रिजल्ट डायलेशन ऑफ pupil occurs. नाउ द यूजेस. सो इसका यूजेस आइज़ में और सीनेस में होता है. आइज़ में ये मिड्रोसिस के लिए यूज़ होता है बाय एक्टिंग ऑन M2 रिसेप्टर. इट ब्लॉक द एक्शन ऑफ एसिटाइलकोलिन बाय विच ब्लॉक कॉन्ट्रैक्शन. एज अ रिजल्ट डायलेशन occurs. और in CNS, it stimulate vagus nerve and biocenters. CNS में ये stimulate करती है vagus nerve और biocenters को. In CVS, it stimulates SA node. As a result, more generation of impulses, increased heart rate, causes tachycardia. It overcomes bradycardia by acting on M receptor. मतलब in CVS ये ब्रेडिकार्डिया के लिए यूज़ होती है क्योंकि ये इंक्रीज़ करती है हार्ट रेट को. इन रेस्पिरेटरी इट कॉजेज ब्रोंकोडाइलेशन बाय डिक्रीजिंग रेस्पिरेटरी सिक्रेशन. ये ब्रोंकोडाइलेशन करती है by decreasing respiratory secretion in case of respiratory problem. In glands, it decreases the secretion of glands, and in G.LT, it acts as anti-spasmodic, means remove spasm, which are the involuntary contraction of muscle. The other uses are like it used in organophosphate poisoning by acting on cholinesterase enzyme. As a result, block the acetylcholine. So ये glands में use होती है by decreasing the secretion of glands. In G.LT ये anti-spasmodic होती है, मतलब remove करती है spasm को. और other uses इसके कुछ यूँ हैं कि ये organophosphate poisoning में भी use होती है. Now the available forms. Mostly available in salt form as atropine sulfate, which is 0.5 to 2% atropine. Ophthalmic solution, which is 1% ointment for eye purpose. The brand is Iso. The antidote of atropine is physostigmine. Of the doses, the general dose for cardiac arrest is 0.5 to 1 mg IV. The maximum dose is 3 mg. Initial dose in cardiac arrest is 0.5 to 1 mg. If 70 kg person, then 0.04 mg per kg. This dose may be repeated till effect is produced. Now the side effects. So number 1 we have tachycardia. Being alkaloidal drug causes constipation, dryness of mouth because stops salivary secretion, blurred vision, cycloplegia, which is unable to focus near vision, which is reversible cycloplegia, sandy eyes, hallucination. So today another drug we have valproic acid. It is also known as sodium valproate and used as an anti-epileptic and available in the form of salt. It introduced in 1978 as a anti-epileptic drug. So valproic acid को सोडियम वैल्प्रोरेट के नाम से भी जाना जाता है. ये एंटी एपिलेप्टिक ड्रग है और ये अवेलेबल होती है इन सॉल्ट फॉर्म और ये इंट्रोड्यूस हुई थी 1978 में एज अ एंटी एपिलेप्टिक ड्रग. So now the mechanism of action. It is membrane stabilizer by opening potassium channel and inhibits sodium channel. As a result, increase potassium influx and decrease sodium influx. The second we have, it act on GABA receptor but not directly. First act on GABA transaminase enzyme, then act on GABA receptor and increase GABA activity. And it also inhibit excitatory neurotransmitter which is aspartate. तो इसका mechanism of action कुछ यूँ है कि ये membrane stabilizer है, मतलब open करती है potassium channel को और inhibit करती है sodium channel को. As a result, increase करती है potassium influx और decrease करती है sodium influx. और जो सेकंड इसका काम है वो ये है कि ये एक्ट ऑन गाबा रिसेप्टर, नॉट डायरेक्टली. ये डायरेक्टली उन पे काम नहीं करती बल्कि फर्स्ट ये गाबा ट्रांसमाइनेज एंजाइम पे काम करती है, देन एक्ट ऑन गाबा रिसेप्टर एंड इंक्रीज गाबा एक्टिविटी. इट आल्सो इनहिबिट एक्साइटेटरी न्यूरोट्रांसमीटर एस्पार्टेट. ये एक्साइटेटरी न्यूरोट्रांसमीटर एस्पार्टेट को भी इनहिबिट करती है. नाउ द फार्माकोकाइनेटिक. It is well absorbed orally and metabolized in liver. 95% metabolized in metabolites and only 5% excreted in unchanged form. Now the plasma half-life is 12 hours and plasma binding capacity is 95% with albumin protein, means only 5% in free form. Now the doses. The initial dose is 200 mg 3 times a day, means total 600 mg per day. The second day increase 200 mg, means total 800 mg per day. The third day also increase 200 mg, means total 1000 mg per day. Then maintain the dose, which is 1.0 gram to 1.6 gram, and maximum dose is 2.4 gram to 3 gram. सो इसका डोज कुछ यूँ है कि इनिशियल डोज हम 200 mg 3 टाइम्स देते हैं, जो कि 600 mg पर डे के बराबर होता है। फिर सेकंड डे पे हम अगेन 200 mg डोज देते हैं, जो कि 800 mg पर डे के बराबर होता है। अगेन थर्ड डे पे हम इंक्रीज़ करते हैं 200 mg, जो कि 1000 mg पर डे के बराबर हो जाता है। देन हम मेंटेन करते हैं डोज को, जो कि 1.0 ग्राम टू 1.6 ग्राम होता है। नाउ द मैक्सिमम डोज इज़ 2.4 ग्राम टू 3 ग्राम। मैक्सिमम डोज हमारा 2.4 टू 3 ग्राम होता है। नाउ द अवेलेबल फॉर्म्स आर लाइक इन मार्केट इट इज़ अवेलेबल एज डेपार्किन in capsule, available as 250 mg, in syrup available in 250 mg per 5 ml, in sustained release it is available in 125 mg or 250 mg or 500 mg, in parenteral 50 mg per ml, in vial 5 ml, and in powder 50 mg per ml. So adverse effects are like nausea, vomiting, tremor, sedation, hepatitis, liver damage, drowsiness, thrombocytopenia, ataxia and hair loss. तो इसके साइड इफ़ेक्ट्स में और द एडवर्स इफ़ेक्ट में नाजिया, वॉमिटिंग, ट्रेमर, सेडेशन, हेपेटाइटिस, लिवर डैमेज, ड्राउजीनेस, थ्रोम्बोसाइटोपेनिया, अटैक्सिया और हेयर लॉस भी शामिल है। The drug-drug interaction. So number one, we have the phenytoin. When valproic acid is given with phenytoin, so it replaces the phenytoin with albumin side. As a result, increase the metabolism of phenytoin. Now the other drug-drug interactions are like lamotrigine, pyrimidine, phenobarbital, lorazepam, valproic acid inhibit the metabolism of these drugs when interacting with them. अच्छा, तो हमने ड्रग इंटरेक्शन की बात तो कर ली, लेकिन ये होते क्या हैं? तो ड्रग इंटरेक्शन इनसाइड ऑफ बॉडी भी होते हैं और आउटसाइड ऑफ द बॉडी भी होते हैं, जो कि फार्मास्यूटिकल ड्रग इंटरेक्शन भी कहलाते हैं। सो हमारे पास जो ड्रग इंटरेक्शंस की जो टाइप हैं वो कुछ यूँ है कि नंबर वन, वी हैव फिजिकल ड्रग इंटरेक्शन, chemical drug-drug interaction and therapeutic drug-drug interaction. So physical drug-drug interactions are visible with naked eyes. For example, drug formulations can alter physically, as by crushing, sustained release could release the drug more quickly or in larger amount as compared to without crushing. So crushing will cause physical interaction, and other example is giving a thyroid drug like levothyroxine. It will stick with the IV bags. Like incompatibility of potassium phosphate and calcium chloride in TPN, means total parenteral nutrition bags. These drugs will react with each other in TPN bags. As a result, there will be formation of calcium phosphate in the form of snow. Now we have the chemical drug interaction, drug interaction. So when the reaction occurs between drugs and cause chemical changes, it is called the chemical drug interaction of drugs. मतलब ड्रग इंटरेक्शन के रिजल्ट में कोई केमिकल चेंज हो तो इसको केमिकल ड्रग इंटरेक्शन कहा जाता है। नाउ द फार्माकोलॉजिकल ड्रग इंटरेक्शन. सो दीज आर क्लासिफाइड एज pharmacodynamic drug interaction and pharmacokinetic drug interactions. And pharmacodynamic drug interactions are further classified or categorized as the additive, synergistic and agonistic. And the additive effect is like when the combined effect of two drugs is greater than the individual effect of each drug, means 1 plus 1 will be equal to 2. For example, alcohol when given with hypnotics. Alcohol induces sleep and hypnotic drugs are also causing sleep induction. So when these two drugs are given together, the additive effect will be produced. Now the synergistic effect, when the combined effect of two drugs is greater than the sum of their effect, like 1 plus 1 when equal to 3. Example, ampicillin when given with gentamicin. Gentamicin is an aminoglycosidic drug and ampicillin is extended spectrum antibiotic. When they are given together, the synergistic effect will be produced. जब एम्पिसिलिन को जेंटामाइसिन के साथ देते हैं तो साइनर्जिस्टिक इफेक्ट प्रोड्यूस होता है जो कि सम ऑफ द टू ड्रग्स से ज़्यादा होता है। नाउ द एंटागोनिस्टिक इफेक्ट व्हेन अ ड्रग रिड्यूसेस और डिक्रीज द इफेक्ट ऑफ एन अदर ड्रग। फॉर एग्जांपल, फ्लूमाजेनल is an antidote of benzodiazepine. When flumazenil is given with benzodiazepine, it will antagonize the effect of benzodiazepine. And other example is like N-acetylcysteine. When given with acetaminophen, it will reduce the effect of acetaminophen. Now the pharmacokinetic drug interactions. So they are classified as absorption, distribution, metabolism and excretion. The absorption is like it is the entry of drug into systemic circulation. अच्छा जी, सो फार्माकोकाइनेटिक ड्रग इंटरेक्शन की क्लासिफिकेशन कुछ यूँ है कि इसमें हमारे पास एब्जॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म और एक्सक्रिएशन है। और एब्जॉर्प्शन ये क्या होती है? इट इज़ द एंट्री ऑफ ड्रग इनटू सिस्टमिक सर्कुलेशन। नाउ द डिस्ट्रीब्यूशन, so it is the reversible process in which drug will leave the systemic circulation and enter into body tissues. Those organs which are highly perfused with blood flow, in those organs supply of drug will be more and faster, means drug will first reach in those organs where blood perfusion is more, and the organs where blood perfusion is less, the drug supply will be less. Now the metabolism. It is the enzymatic conversion of a drug. It is also called as biotransformation. It involves two phases. Phase 1 involves chemical reaction and phase 2 is called conjugation. For example, aspirin undergoes phase 1 to form salicylic acid, and then salicylic acid undergoes phase 2 conjugation to form sulfate, glutathione and glucuronide. So drug-drug interaction mostly occur in phase 1. Liver is main metabolizing organ of body. Liver consists of Cytochrome P450 system. It is the system which produce more quantities of enzyme. Example, cimetidine is H2 blocker used for peptic ulcer disease. If a person is smoker and using cimetidine, in such cases, smoking will increase the activity of enzyme. As a result, cimetidine will metabolize rapidly. Now the elimination. Major organ is kidney. Kidney performs three functions. Number 1 is glomerular filtration, tubular secretion and tubular reabsorption. So major eliminating organ kidney है और इसके 3 काम होते हैं. Number 1 is glomerular filtration, number 2 is tubular secretion, number 3 is tubular reabsorption. So glomerular filtration and tubular secretion are responsible to remove the drug, but tubular reabsorption reverses back drug into blood. For example, probenzoic acid is a drug used in treatment of gout, and penicillin is broad-spectrum antibiotic. When they are given together, it will inhibit the tubular secretion of penicillin. So after drug-drug interaction, we have another drug like Dobutamine. It's sympathomimetic drug. This drug is commercially available as Dobuterex. Mechanism of action is like dobutamine is beta-1 receptor agonist. Dobutamine increase the positive inotropic and positive chronotropic effect, means increase the cardiac output and heart rate. Now it's pharmacokinetic. Half-life is 2 minutes only, available in parenteral form, 1 or 2% oral absorption. Onset of action is rapid. 10 minutes are required to reach steady state concentration. Steady state concentration is when drug shows its maximum pharmacological effect. During metabolism in liver, it is converted into 3-methyl dobutamine, which is then excreted into urine. Now the pharmacological effect of dobutamine. It is used for congestive heart failure as it increases the cardiac output. It is effective as it increases cardiac output without increasing of oxygen demand. Now its adverse effect. So we have the atrial fibrillation. Heart rate is more than 300 beats per minute because it increases the AV conduction. And then the atrial flutter. If heart rate is according to 250 beats per minute. Then the ataxia, which is the loss of muscular coordination. Other include like headache, palpitation, and tachycardia. Now the dose, which is 2.5 to 10 mg per kg per minute. It is available only in parenteral form as vial of 12.5 to 20 ml drug. Now the drug-drug interaction. When dobutamine is given with reserpine or with metadopa, it will decrease the effect. When dobutamine is given with general anesthetic like halothane or cyclopropanol, it would increase that side effect.